So always be thankful to patient. Okay. He is under my care. He is a case of Pakshagata. When he came, he was not able to walk and he had severe pain. ஐயா உங்களுக்கு வந்தப்போ எப்படி இருந்தது?
வந்தப்போ ரொம்ப ஹெவியாக இருந்தது சார். கிராஜுவலாக அப்படியே குறைஞ்சிடுச்சு.
நடக்கிறதெல்லாம்
கொஞ்சம் நல்லா ஒரு 50% நடக்கிறது எல்லாமே. முதல்ல நடக்கமே ரொம்ப அவசரப்பட்டுருக்கேன் சார். இப்போ நடக்கிறது எல்லாமே வந்து ஒரு 50% நல்லா. பேச்சும் வந்து நல்லா இதாக இருக்குது சார், ஃப்ளூயண்ட்டாக. முதல்ல ஒரு திக்கி திறனை பேசுங்க சார். இப்போ பேச்சில் வந்து நல்லா இதாக இருக்குது. ஹேண்ட்ஸ் ஆல்சோ வந்து நல்லா
நல்லா இதாக இருக்குது. ஓகே, தேங்க்யூ சார். திரும்பி பார்த்துக்கோங்க. ஆக்சுவலி பக்ஷாகாரத்தில் ரக்தமோக்ஷனை சொல்லியிருக்கா இல்லையா? இஸ் தேர் ஆர் நாட்? Where we study only Pakshagata Virachanam or Rakta Mokshana also. Then why we don't do that? And one more thing, in Rakta Mokshana I forgot to ask one question to you. You would have seen so much of Vata Vyadhis in Rakta Mokshana, right? But basically when you do Rakta Mokshana, Vata should increase, no? Right? Vata should increase. Ayya vaanga. Vanakkam vaanga. Vata should increase when you do the Rakta Mokshana because Dhatukshaya is happening. Vata increases by two things. One is Dhatukshayam. Second one, what are the causes of Vata increase? Avarnam and Dhatukshayam. So when you do Rakta Mokshana, Dhatukshayam is happening, Vata increases. But in so many Vata Vyadhis, Rakta Mokshana is mentioned. Why? Anybody can say why it is mentioned in so many Vata Vyadhis? Yarka theriyuma? Answer. Theriyada? It's very simple. When there is Rakta Avarna, then only Rakta Mokshana should be done there. It is not that in all Vata Vyadhis you do Rakta Mokshana. No. When Vata Vyadhi associated with Rakta Avarna, then only Rakta Mokshana should be done. Otherwise all other kriyas should be done. Okay? That is the reason. So now we will ஐயா ஒரு சின்ன ஒரு இது போடுவேன், கொஞ்சம் வலிக்கிற மாதிரி இருக்கும். சரிங்களா? நல்லா கம்ஃபர்டபுளாக படுங்க. கம்ஃபர்டபுளாக பண்ணல, நல்லா படுத்துக்குங்க. கம்ஃபர்டபுளாக படுங்க. நல்லா ரிலாக்ஸாக படுங்க. இது கீழே வச்சுக்கோங்க. இது கீழே அப்படி படுங்க. இப்படி தான் படிப்பீங்களா எப்பயுமே? மேடாக தான் இருக்குமா? ஓகே, ரிலாக்ஸாக படுங்க. சரிங்களா? ஸோ வி வில் ஜஸ்ட் we'll do it in a, because Shringam, Shringam should not be done in the Sandhis, right? So we will do in a where there is a more flush is there. Okay, Kiran, ready aayiriki? So aseptic should be done. Okay, one small cut will make. Okay, so always use number 11. This is very small and sharp. Okay, yeah, or chinna cut. Thank you. Yeah, பயப்படாதீங்க. So always, as I said, when you can do when you can do Svedana, it will be better. Okay, see in these areas you need to put a little bit more this one. Kiran, so you apply this, okay, tightly, and this is you pull. Okay, pull. Amma, where is that needle? Put the needle. See, this is now blood is oozing. You see, blood is oozing. Put the needle now. This is modified Shringa. Okay, yeah, leave it. Okay, this is modified Shringa. You see the blood is oozing. Slowly it will ooze, then it will stop on its own. Okay, this is modified Shringam. Okay, என்னதுப்பா? இதை எடுத்துட்டு நம்ம வேக்யூமை ரிலீஸ் பண்ணால் ரிமூவ் ஆயிடும். கொஞ்சம் நேரம் இருக்கட்டும். இவருக்கு இந்த பெயின் இந்த கையிலையும் இருக்குது, இந்த கையிலையும் இருக்குது. ஸோ தட்ஸ் இன் த மிடில், ஆல்வேஸ் ரத்த மோக்ஷனா வேர் இட் இஸ். சப்போஸ் யூ ஆர் நாட் ஏபிள் டு ஃபைண்ட் த வெயின் இன் சிராவேதனா, wherever the disease is there, nearby site. Okay, excuse me, cut in the nearby site, as simple as that. So this is modified shringam. Okay, you can see the blood is collecting and it will stop on its own. Okay, if it is not stopping, then definitely you must use. I didn't put much cuts because I don't want, it's only demonstration, so I don't want to put much cuts. Otherwise, if had I put little bit more cuts, it would have filled very easily this much. Okay, so this is modified shringam. It's where the vacuum is created and we sucked. So as I told, shringam is sucking, right? So just we used this and we sucked the blood. So basically this is modified shringa. Okay, so antiseptic we have to remove and we have to clean this. Okay, so in this patient only I will show you wet cupping, dry cupping and everything. We can use the same place for that cupping also. Okay, amma ukkarunga, ask the patient to sit ma. பார்க்குறதுனா பார்க்கலாம், ஆனால் பயப்படக்கூடாது, அது சொல்லிடுங்க. வலி ஒன்றும் இல்லையே?
இல்லை சார்.
தலை சுத்தல் ஏதாவது இருக்கா? தண்ணி ஏதாவது வேணுமா?
இல்லை சார், தேவையில்லை.
சரி. ഇവിടെ തന്നെ. See, and one more thing, it's a good patient, we can do agnikarma also. You see this skin tag and it's a kind of mild neuro fibrosis is there. Okay, so we can do the agnikarma here. Dr. Sariga, ഇതിന് നമുക്ക് അഗ്നികർമ്മ ചെയ്യാലോ, മറ്റേ സ്മാൾ കാട്ടറി വെച്ചിട്ട്. One more method is there. Suppose you don't want to go such things, you use suture thread. Make one small cut around it, tie the suture thread tightly. The third day it will fall down. It's very simple. So this we can see the blood is clotted now. This we can remove. So come ma, you help to remove this. You first first remove this. You catch here, down, remove that. Okay, remove the, yeah, slowly remove. Okay, yeah, now you see the vacuum is released, it is going inside. Okay, be careful, and you can put the hole also little bit bigger if you want. Okay, enough, it has come. You slowly, when you remove, you need to remove from the side. Amma, cotton eduthuko. Okay, spirit vechirkiya, so make the cotton like that, from the side you remove. So you remove. Okay, and from the sides you remove. All right, don't pull from up. Okay, just from the sides you remove. Okay, so this is modified shringam. Okay, now I will show you dry cupping. Okay, the same patient, I will show you the dry cupping. So spirit you can use. Okay, you give him the cups. Okay, relax up padungiya.
Right sir. Okay.
I will show you the dry cupping. So there are so many varieties, you can pull also, and this is more easy for me. Okay, where you can simply unscrew it and screw it. Okay, so take 2-3 cups, appa 2-3 cup edupa. So where there is a flush, you see there should not be any space, there should not be any space. Okay, apply the cup. Okay, tightly hold it, you see, then you unscrew it. You can literally see the skin and with the muscles goes up. ஐயா வலிக்குதுங்கயா?
இல்லை சார், ரவுண்ட் இல்லை சார்.
வலிச்சா சொல்லுங்க.
ரைட் சார்.
So this is dry cupping. One more, இதே போல். Okay, I will show you. Okay, leave it. I will show with in this I will show with fire. So always don't use the spirit. It will extinguish very faster, and when you remove it smells badly also. So I use perfume, so it smells nice when you remove, and alcohol is also less, so it won't burn the patient's this one also. So when you do this cupping, one more thing, always put oil, because you want to do it for relieving the pain. Okay, so basically apply the oil irukappa, apply one side oil, little bit apply. So before cupping you apply oil. Okay, okay. So now see, when you are doing this, it should be very faster, otherwise it won't hold, it will fall down. I'll show you. Little bit spray and fire. Okay, inge small இல்லையா, சரி கொண்டா 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 கொண்டா. So 1 or 2 spray enough. Okay, that's it. You see, if you don't do it faster, it won't hold there. You should do it immediately, otherwise this is gati yantram, otherwise it won't. Okay, suppose you want to do with blood, then you need to make cut. Okay, if you want to do with blood, you need to make cut, it will take out the blood. So now in this we will make one small cut, and I will show you in this. Okay, so once this is done, give me shallaki oil, shallaki oil. So always do the massage. This area will be, and in the, you must tell the patient 2-3 days you it may look black, especially in female. If they are very fair, in may, you know, they may feel like, oh my god, you screwed up my skin. Okay, so you must tell it will look black because of, you know, the contusion and everything. So advise that. Okay, that's a part of the therapy. ஐயா ஒரு சின்ன கட் போடுறேன்.
ரைட் சார், ஓகே.
ரொம்ப தேங்க்ஸுங்க ஐயா.
ஓகே சார், நானும் நன்றி சொல்றேன்.
So now this is called wet cupping, where you will be relieving the blood. Okay, okay. Yeah, you see the blood is oozing now, and when you are doing these procedures, you must act very fast, otherwise the patient will have pain. It should be done very very fast. Okay, you can say I made a cut, small incisions, immediately applied. It should be like seconds. If not, patient will not cooperate. He will say burning, no sir, I don't want, it's painful, everything. So it should be very very fast. Okay, so whenever you are removing, don't remove like this. Okay, press the skin like this, both sides, from sides. Okay, it will come, that's it. So this is gati yantram. Okay, so with fire, without fire, and wet cupping, dry cupping, these are the different methods can be used, depends on the condition of the patient. You can use different therapies. You can see, because I put so many cuts, the amount of blood is little bit more here. Okay, വേണ്ട മറ്റേത് അഗ്നികർമ്മം ചെയ്യാം, അത് എടുത്തുണ്ടോ. This is, you see, this is modified Agni Karma. Okay, you get it in Amazon also, the small you know, skin tags. Okay, all those things you can use this, and you can remove it, you know, But if it is very big, you cannot use this. For small skin tags, you get it in neck or underarms. Usually where you get this, in obese people, in insulin resistance, in polycystic ovaries. This is very common in females. If you see obese, insulin resistant and polycystic ovaries, and male also obese person, and in insulin resistant cases you see the skin tags. Okay, so by removing it will not help. You need to advise the patient to reduce the insulin resistance. Okay, exercise, less carb diets. Okay, all those things will help to reverse this condition. Okay, so this is very small, so we cannot use, but we will use one small agnikarma. ஐயா இங்க ரெண்டு பெருசா இது இருக்கு, அதுல ஒன்னு ரிமூவ் பண்ணி கொடுக்குறேன் உங்களுக்கு. சரிங்களா? So if you don't want the patient to feel the pain, you can use local. Okay, simply pump the local anesthesia and use it, pack it and send the patient. Okay, சரிగా local ഉണ്ടോ? anesthesia എടുത്തിട്ടുണ്ടോ? லோயின் எங்கடா நம்மளது மேலே இருக்கா? கொஞ்சம் எடுத்துன்னு வர சொல்லு. So this agnikarma I will show you, and this one you can do ksharakharma also. Okay, if you can use apamarga kshara, or there is one nice preparation available in Tamil Nadu. It is called kalani kalimbu. Okay, that is not only for kalani. You can use it in skin tags, but be careful. If you use it more, I think because that fellow is adding this sulfuric acid in it. It's not original ksharam. Okay, because in some cases what happened when I used, the people developed what do you say that? I forgot. Sometimes, sorry, I'm forget. Not blister. After the injury you develop, no? Scarring. Yes, scarring, and above that one more. Not boils. Scarrings and second keloids. Yes, yes. So sometimes people are developing scarring as well as keloids when you use that kalani kalimbu more. Okay, so you should be very careful, and they have given the applicator also. Don't use that. Use the toothpick and apply only in that particular area. And one more thing, advise the patient when you use them, it is creating blackish discoloration. So it takes 6 months or 8 months to go. Sometimes it is taking a year to go away also. So tell all these things to the patients. Okay, so now the blood is clot, we can remove this. Okay, അതിൻ്റെ ഉള്ളിൽ നമുക്ക് അടുത്ത് ലീച്ച് കാണിക്കാം. So now we will remove this. Okay, this is spirit. So you always see, keep the side. Okay, so keep it, and I am going to remove it in the sides. So yeah, just remove it. So always after that autoclave it. And one more thing, before using the cup, please autoclave them. Okay, please autoclave them. Whatever instruments you are using, autoclave them, then you use. Okay, okay. And one more thing, after this nice massage you do. Okay, and if the bleeding is not stopping, you can use this ice and all. If there is numbness and other things, you can use the ice and everything. All right, ஐயா எஞ்சிக்கோங்க போதும். நான் அதை சூடு பண்ணிவிட்டு அதுக்கு கொஞ்சம் லோக்கல் லைட்டாக கொடுத்துட்டு உங்களுக்கு பண்ணுறேன், அப்போ வலி இருக்காது. இந்த இதை எடுத்து கொடுத்துட்றேன். அதை எடுத்து கொடுத்துட்றேன். சரியா? அது வேண்டாம், உங்களுக்கு லோக்கல் கொடுத்துட்டு செய்ய. நன்றிங்க ஐயா.
நன்றி சார்,
நன்றி. வாங்க வாங்க, ஷர்ட் போட்டுக்கோங்க.